Workshop on Excellence empowered by a diverse academic workforce, chemists, chemical engineers, and materials scientists with disabilities. In February 2009, the Workshop on Excellence empowered by a diverse academic workforce convened to discuss issues and solutions related to scientists with disabilities, particularly chemists, chemical engineers, and materials scientists. Conference organizers included Kristen Bowman James and David Benson, both on the chemistry faculty at the University of Kansas, and Tom Maluk, a chemistry faculty member at Pennsylvania State University. A flourishing scientific community is a diverse one that harnesses the special perspectives of a variety of individuals, including those with disabilities. Prominent scientists with disabilities have included Pierre Janssen, traveled the world studying solar eclipses, discovered helium, unable to walk due to a childhood accident. Albert Einstein, physicist, is said to have struggled with echolalia, involuntary repetition of words and phrases. John Cornforth, deaf since his teens, shared a Nobel Prize in 1975 for his work in chemistry. Stephen Hawking, physicist. As a young man, Hawking was diagnosed with ALS, a degenerative disease of the nerve cells. And Temple Grandin, doctor of animal science, is autistic. Disabilities are clearly no obstacle to fruitful, even revolutionary careers in science.
The data problem.
Information is very limited on the experience of people with disabilities who work in scientific fields, but it is clear they are underrepresented in the sciences when compared with the general population.
Joan Borelli, senior analyst for the National Science Foundation, told workshop attendees, "If the incomplete available statistics can be trusted, there are proportionally fewer professors with disabilities in academic departments than persons with disabilities in the general workforce."
Individuals with disabilities make up 16% of the general population ages 25 to 64, but only 11% of undergraduates in science and technology, and only 1% of PhDs in these areas. It is also reported that 7% of PhD faculty in these fields have disabilities, some of them age-related. This serves as a reminder that any one of us could acquire a disability at any time because of age, accident, or many other causes. Generally, disability is defined as a physical or mental impairment that substantially limits one or more of the major life activities. These activities include seeing, hearing, speaking, walking, breathing, performing manual tasks, learning, sitting, standing, lifting, mental and emotional process, thinking, concentration, interacting with others. Disabilities fall into two general categories, visible and non-visible. The first includes a range of physical impairments, from missing limbs to blindness. Invisible disabilities also include a broad variety of issues, from learning disabilities to emotional and psychological issues. Individuals with disabilities, particularly subtle or non-visible ones, may hesitate to mention it due to common misperceptions that workers with disabilities will be unable to complete required work or, in scientific fields, that they will pose safety or employment risks in a laboratory setting.
Accommodations and support.
Steve Ramirez, Equal Opportunity Specialist at the University of Kansas, spoke to workshop attendees about the Americans with Disabilities Act.
The ADA was a law that was created to ensure that people with disabilities can fully participate in society, and that includes work. And as an employer, it's our responsibility to make sure that we focus first on what is people's abilities and not their disabilities.
And with today's signing of the landmark Americans for Disabilities Act, every man, woman, and child with a disability can now pass through once closed doors into a bright new era of equality, independence, and freedom.
The ADA was amended in 2008. The amendment greatly broadened the definition of disability and clarified how the ADA should be applied. How do you provide a supportive work environment for employees and students with disabilities while also protecting their privacy and holding them to the same standards as their comrades and coworkers? When hiring, the employer may not ask whether the individual has a disability, but may ask whether he or she can perform the essential functions of the job. It is up to the individual with a disability to disclose this to the employer and request accommodations.
Sometimes, though, they're going to require what is called a reasonable accommodation. And so as an employer, we're going to look for ways to try to accommodate those persons so they can provide to perform the duties of the job.
The ADA leaves lots of room for interpretations in reference to the call for reasonable accommodation.
There's as many different definitions of reasonable as there are people in this room.
But it's important to create settings, whether in the classroom or the laboratory, that will encourage people with disabilities to enter and continue to work in scientific fields. Ian Shipsey lost his hearing in 1989, soon after being hired to teach physics at Purdue. His deafness was caused by a powerful prescription antibiotic that destroyed the hair cells in his cochlea. He told workshop attendees how he and the university learned to work with his disability. They soon discovered that Shipsey's deafness was in some ways an advantage, as he was able to work with foreign students whose limited English skills proved too difficult for Shipsey's colleagues. Despite having to adapt to a sudden disability, Professor Shipsey received the Purdue Physics Professor of the Year award after his first semester of teaching. In addition, he and a deaf colleague successfully campaigned for cochlear implants to be covered by the university health plan, an accommodation that Shipsey recommends to all institutions.
There is a real fear among students that somehow in the transcript there will be an asterisk that will say, "This PhD was achieved with accommodations."
Institutions may meet the requirements of the ADA by making tailored accommodations, which is done by request and on a case-by-case basis. Tailored accommodations might include improved accessibility through such changes as wheelchair ramps, accessible restrooms, and furniture scaled to the height of an individual using a wheelchair. Allowing extra time to accomplish a task is a form of accommodation that may be important for those with invisible learning disabilities, as well as for people with physical issues. Other tailored accommodations can be addressed by providing assistive technology.
Virginia Riley, Director of ADA Services at Virginia Tech, spoke to the workshop about specific accommodations for people with cognitive and learning disabilities. She related the story of a faculty member whose struggle with depression had resulted in a cluttered office that was difficult to work in. The professor was offered a student assistant and a temporarily reduced workload, among other accommodations. Implementing effective tailored accommodations must involve both creative thinking and compassion.
David Wohlers, a professor of chemistry at Truman State University, has been blind since childhood. He identified possible assistive technology for the visually impaired. A digital recorder, for example, might help an individual to accurately recall lectures and other verbal communication. Wohlers also discussed technology that enables writing in Braille, a system of raised dots that corresponds to written letters.
For you to read, you just have to move your eyeballs. For me to read, I have to move my hands. So there's a lot more time and energy involved in being blind as opposed to being sighted.
Significant numbers of people of working age suffer from mental disorders, such as various forms of anxiety and depression. Victor Day, Director of the Small Molecule X-ray Crystallography and Protein Structure Laboratories at the University of Kansas, has one of the so-called invisible disabilities.
About 15 years ago, I became aware of the fact that I have rapid cycling bipolar disorder.
Day discussed his condition with his department chair, but did not request accommodation.
As a result of my experience and experiences with fellow colleagues that have similar types of disorder, for example, anxiety or depression, I've become somewhat outspoken with respect to people who have these types of invisible disorders, letting it be known that they do indeed have them. If you have this type of invisible disorder, you should let your department chairman know about it so that accommodations can be made, because they are guaranteed by the law.
If you do have a disability, you shouldn't keep it quiet.
Universal design.
Unfortunately, individuals may hesitate to talk about their disabilities due to the stigma often attached to special treatment. A partial alternative to creating accommodations on a case-by-case basis is to avoid needing most accommodations at all.
Cheryl Bergstaller, Director of Disabilities, Opportunities, Internet Working, and Technology at the University of Washington, speaks about universal design. Universal design refers to creating products and environments that are usable by all people to the greatest extent possible without the need for accommodation or modification.
Universal design means a more welcoming environment for everyone. Such adaptations include ramps and curb cuts, essential to those using wheelchairs as well as to bicycles and strollers. William McCarthy, professor of civil engineering, New Mexico State University, provided perspective on changes in accommodations over several decades. McCarthy lost use of his legs in an auto accident over 40 years ago, yet he persisted with his interest in science.
I was happy they were willing to take a table, prop it up, and keep the chemicals in front of me. That was a very good concession then. Today, we should expect a lot more.
McCarthy advocated making labs as mistake-proof as possible with simple modifications, including clear access to safety stations, plastic containers with no-spill stops, and lab assistants trained to spot safety and accessibility issues.
Recommendations.
The workshop on excellence, empowered by a diverse academic workforce, concluded with breakout groups, each brainstorming recommendations in response to a specific question. Question 1. Accessibility. How does a university develop safe, effective access to facilities for people with disabilities? The group recommended university-wide planning and a flexible, standardized suite of services for those with disabilities. Best practices and a menu of low-cost accommodations and universal design choices, along with a list of funding sources, should be made available to all universities. Question 2. Non-visible disabilities. How does a university develop adequate accommodations for people with non-visible disabilities? What resources are available for this population? Attendees recommended that the school provide a positive and supportive environment where disabilities of all kinds are recognized and addressed in respectful and effective ways. Faculty should meet with an ADA expert or staff support counselor to discuss the ADA and learn about available resources and options. Question 3. Instructional tools. Are your university's instructional tools accessible to all users, including those with disabilities? Although individuals with disabilities must take responsibility for requesting assistive technology, available options should be discussed in regular classroom visits from an accessibility counselor and through an active liaison with an ADA or support office. The National Science Foundation should fund basic forms of assistive technology. Question 4. Access to information. What resources are required to ensure appropriate access to information for either classroom or research use? Universities should actively seek training about disabilities and should provide research experiences targeted at undergraduates with disabilities. A national organization or federal agency should create and maintain web resources for community building and mentoring for both faculty and students with disabilities. Question 5. Agencies and professional societies. What new strategies can be used by federal agencies, professional societies, and other external stakeholders to minimize barriers faced by those with disabilities? Federal funding agencies and professional societies, as well as universities, should make their resources and events as universally accessible as possible, with active recruitment of people with disabilities and centralized information on accommodations and institutional resources. Question 6. Internal assessment. How can departmental and institutional attitudes to disabilities be assessed? How can these assessments inform efforts to recruit and retain people with disabilities? Universities should review their strategic hiring plans to actively include those with disabilities, include clauses about disability in new and renewed contracts, expand student disability services to include faculty, and accommodate disabilities by thoughtful reassignment of responsibilities. Question 7. Faculty development. How can strategic plans and incentives be developed to attract, recruit, and retain a faculty that includes people with disabilities, both visible and non-visible? Mentoring networks of faculty with disabilities should be developed within institutions and through national professional organizations. Question 8. Mid-career disabilities. What are best practices for accommodating faculty members who develop disabilities mid-career? Departmental chairs should encourage communication about disabilities. The faculty member in question should notify the campus ADA coordinator of changes in disability status and should discuss with his or her chair the possibility of recurrent symptoms that might interfere with job duties. The university should, in the case of short-term disabilities, allow temporary suspension of the tenure clock and grant flexible sabbaticals.
Conclusion.
Attendees of the Workshop on Excellence, empowered by a diverse academic workforce, agree that a flourishing scientific community is a diverse one that includes scientists with disabilities of all types. Actions must be taken to make the scientific fields more welcoming and accessible to people with disabilities. Your discussions about how to achieve these goals might include acquiring data that will increase understanding of why students with disabilities are less likely than the general population to pursue training in the sciences, developing mentoring programs, targeted fellowships, and support systems to encourage students and young faculty with disabilities, communicating regularly with ADA offices and other institutions to make the office and laboratory environments friendlier to individuals with disabilities, incorporating into institutional policy the principles of inclusiveness and universal design. Organizers and attendees of the workshop hope that sharing their discussions will encourage a discipline-wide movement towards maximally inclusive environments that will increase the chances of success in the sciences for people with disabilities. Now ask yourself, how can you help? For more information about the conference and the resulting recommendations, refer to the final report of the Workshop on Excellence. The report is public domain and may be copied and distributed freely without charge. A PDF version may be accessed at www.nsfepscore.ku.edu under Publications, or call today and have multiple copies of the report shipped to you free of charge. Kansas NSF EPSCOR, Foley Hall, 2021 Constant Avenue, Lawrence, Kansas, 66047. 785-864-3096. NSF EPSCOR@ku.edu.
The workshop, report, and this video presentation were sponsored by the National Science Foundation under grant CHE 0854967 and the National Institute of General Medical Sciences, National Institutes of Health.